Heartburn is a burning sensation in the mid to upper chest. It feels like a pressure or a bloating and can come along with reflux. It occurs sometimes at night or after a big meal. And it's of concern when it's going on more than twice or 3 times a week, more than 2 weeks at a time, or if it doesn't go away when you're taking those regular antacids over the counter or some of those proton pump inhibitors which are now over the counter. That's when it's time to call your doctor. So if you're just having the run-of-the-mill heartburn, that first attack in the middle of the night, you ate something, I suggest taking an over-the-counter Zantac, Prilosec, or ranitidine. Any of those over-the-counter medications should help you feel better. Even a Tums or a Maalox can also be helpful. If you're having symptoms more often, maybe once, twice, 3 times a week, that may be time to take a daily medication like a Zantac or a proton pump inhibitor like omeprazole or Prilosec. And then if those symptoms aren't better within 2 weeks, that's when it's time to call your doctor. It may need a prescription to help you get better. There are side effects that have been described in the recent media and in the literature about proton pump inhibitors and H2 blockers, the most common medications for antacid medications for reflux and heartburn. Most of those risks are pretty small. In general, the risks of not treating someone who has esophagitis or inflammation of the esophagus, who has narrowing of the esophagus, or somebody who's taking Motrin, Advil, and is older or on blood thinners, the risks of not treating are pretty low compared to the benefits. If you need the medications, then you should take them for your symptoms. And long-term, the risks that have been described happen rarely, but they do happen sometimes. So thinning of the bones or osteoporosis has been described. Low calcium, magnesium, phosphorus is recently described and has actually an FDA warning now. There are some indications that being on these proton pump inhibitors long-term can increase the risk of some infections. There's a colitis that you can get, pneumonia, or something called small bowel overgrowth. These are very small risks, and in the grand scheme of things, if you have a good reason to take the medications, then you can take them safely and you don't have to worry about these risks. But definitely talk to your doctor, especially if you're taking Plavix. You may need to change the timing or the dosing of your medication a little bit, but I think most of these medicines are very safe, and we have a 30-year experience with them, and they've been and proven to be really effective and safe medications. When your medications aren't working well for you, you have to take a step back and look at the whole picture. Most people who don't have good response to these medications, which are highly effective, aren't taking them at the right time. So you should really try to take them about 30 minutes before a meal. Sometimes people who are taking once-a-day medicine need that twice-a-day medicine in order to help with their symptoms, especially at night. So a second dose taken before dinner can really help. If they're really still not working, sometimes switching medications will help, but most of the proton pump inhibitors are very effective, and they're pretty equivalent between the different classes. When I see patients who aren't getting better, I also ask them a couple of questions. Are you eating late at night? Do you eat right before you lie down? And are you drinking tons of sodas or coffee or really kind of caustic acidic foods? Those things can really set off symptoms, and no matter how much medicine you take, I can't overcome a Big Mac and fries with medication. So you really need to take the time to change your lifestyle, and that really helps the medication do what it's supposed to do. There are some lifestyle changes that most people can make to help with their heartburn symptoms. The first thing is to make sure that you haven't gained a little bit of weight recently. If you're up 10 or 15 pounds from where you used to be, sometimes losing that weight can really help get your symptoms under control. Another thing that people do is drinking a lot of sodas, coffees, or other acidic foods. And no matter how much medication you take, you cannot overcome the acid that's in a cup of coffee. So really cutting back on how much coffee or soda you're having can have a big impact on your symptoms. The last thing that I recommend is don't eat late at night and don't lie down right after eating. try to leave about 2 hours between the time that you finish a meal and the time that you lie down. That'll really help with your symptoms and maybe cure the reflux that's been really bothering you. Many patients are really worried when they get heartburn symptoms that something might be going on with their heart. When you have heartburn, you have a burning discomfort in the chest that usually happens after a meal. When you have heart problems, they usually happen when you're walking around, exerting yourself, climbing up a flight of stairs, and the heart symptoms often come with shortness of breath, a feeling like you have neck pain, jaw pain, or arm pain, or shoulder pain, and they often continue to happen or happen in an increasing frequency the more you kind of move around. Most people who are having heartburn, however, are just having heartburn. And so they don't really need to worry. But it's always a good idea when you first have symptoms to get checked out by your primary care doctor, or if you're having severe chest pain, to go to the ER and really have a full and complete evaluation.